Kia ora koutou katoa. Good evening, everyone. I want to start by acknowledging that Dr. Bloomfield has accompanied me for this press conference in order to answer any questions that may arise from this statement that I am about to make and the decisions that have been made by Cabinet today. It has been 53 hours since we moved Auckland into COVID Alert Level 3 and the rest of New Zealand to Level 2. This afternoon, Cabinet met to receive the latest information and advice from the Ministry of Health and to discuss next steps in our resurgence response plan, a plan with the primary purpose of restoring our Level 1 freedoms as quickly as possible. We have made a good start on that plan. This is what we know about the new infection in New Zealand. We have identified 29 cases. At this stage, all remain linked to one cluster centred in Auckland. One other case that is likely linked to the cluster is still being investigated. We have undertaken more than 30,000 tests in the last 48 hours. 38 people linked to the cluster are now in government-managed quarantine as a precautionary measure. There are signs we have found this outbreak relatively early in its life. While the first case we identified tested positive this Tuesday, extensive testing and contact tracing has since determined that the earliest case we have found to date was a worker at the Americold Cool Store in Mount Wellington who became sick on approximately the 31st of July. This may not yet be the origin of the outbreak, but on the information we have to date, it's the earliest sign of the re-emergence of the virus. In terms of the ongoing investigation to identify where the virus originated from, there is still no clear connection at this point. Contact tracing and genomic testing has not found a link to the border or managed isolation and quarantine facilities at this stage. The sequence of the virus from the current outbreak is not the same as the sequences from community cases in our first original outbreak in New Zealand. This suggests this is not a case of the virus being dormant or of a burning ember in our community. It appears to be new to New Zealand. In terms of wider surveillance, since I made the announcement to move alert levels on Tuesday, we have tested more people than in any other time we have had COVID in New Zealand. We have stock for a further 303,000 tests currently in New Zealand. The Level 3 restrictions and the speed in which they were implemented will have made a material difference in containing the spread of this outbreak. So will everyone's compliance with those restrictions. Auckland travel data yesterday, the first full day of Level 3, shows a 60% reduction in travel compared with the last 3 Thursdays, which is even less travel than at Level 3 last time, which just demonstrates the incredible job that Aucklanders are currently doing. This is also what we know. We know the incubation period for COVID-19 and our experience of previous clusters, some of which reached more than 80 cases, means we can expect to see more cases as part of this cluster. It will grow before it slows, and it may continue to be linked to schools, churches and social gatherings as it has done to date. We also know, based on overseas experience and our own, that it is possible to contain a cluster or outbreak without ever being able to identify its origin. What is important is making sure that we establish the perimeter of the cluster and to stop it from growing. To do this, we do need to take into account that all-important incubation period. And so, in keeping with our precautionary approach and New Zealand's philosophy of going hard and going early, Today, Cabinet has agreed to maintain our current settings for an additional 12 days, bringing us to a full 2 weeks in total. Our current expectation is that by this time, the perimeter of the cluster will be identified, will be isolated, and we can move to level 2 in Auckland with confidence. That means Auckland will remain at level 3 and New Zealand will remain at level 2, the rest of the country, until 11:59 p.m. on Wednesday the 26th of August. We will, however, review these settings on the 21st of August. We want to give about a week's time to see how we are travelling before we review again. I would characterise our approach as short but precautionary hold in an ongoing investigation so that we continue to stamp out the virus. There is nothing to suggest we need to move to a level 4 lockdown at this stage, as we do not have a number of clusters or unrelated cases. I'll say that again because I've seen a lot of speculation. There is nothing to suggest we need to move to a level 4 lockdown. Cabinet also does not want Auckland to be in level 3 any longer than is needed to ensure the outbreak is managed. Our intention is that Auckland and New Zealand will quickly move back down through alert levels if we continue on this track. But it is wise to take a bit of extra time. That bit of extra time is our best way of getting out quickly. As always, the best economic response is a strong health response, and short and sharp is best. Lifting restrictions now and seeing a potential explosion in cases is the worst thing we could do for Auckland and the New Zealand economy. At the same time, level 3 does allow us to continue with more activity than a full level 4 lockdown, and I do think that's important to remember. Estimates are that the economy operates at roughly about 80% at level 3 compared to 60% at level 4. I am mindful, though, of the extraordinary disruption to business and the anxiety that this outbreak will be causing. As before, we will use what tools we have to protect jobs, incomes and businesses as well as people's health. To provide certainty to businesses and workers, I can confirm today that Cabinet has made an in-principle decision to extend the wage subsidy scheme to support businesses and protect jobs as we undertake the public health measures required to fight the virus. Finance Minister Grant Robertson will be working through the final details with officials and Minister Cipollone over the weekend. But I can say that the extension to the wage subsidy will be nationwide and will cover the period of time that the current level 3 restrictions remain in place. Minister Robertson is here, and once Dr. Bloomfield and I leave the podium, he will take the stage to give a bit more of an explanation and answer any questions you have on that. I want to touch very briefly on the activity that continues in Auckland under level 3 with the appropriate health and safety protocols in place. Auckland Transport has 44 construction sites operating under level 3. Construction continues across 5 sites on our largest infrastructure project, the City Rail Link, with about 1,200 workers. The Employers and Manufacturers Association has said many food service businesses that closed during level 3 last time are this time adapting and trading on a click and collect or delivery basis. And houses continue to be built in Auckland. Kāinga Ora alone has over 150 projects with over 3,000 units under construction. All of this is happening because of the protocols on operating safely at level 3, which includes social distancing at work sites. If you have questions over whether your business can operate, please visit the COVID-19 website or contact MB directly. To summarise, as we have said from the start, our overall COVID-19 strategy remains elimination. That requires the ongoing stamping out of the virus any time that it comes back. Together, we have got rid of COVID before. We have kept it out for 102 days, longer than any other country. We have been world leading in our COVID response, with the result that many lives were saved and our economy was getting going faster than almost anywhere else again. We can do all of that again. 1.5 million New Zealanders in our biggest city are carrying a heavy load for our team of 5 million right now. But together, we will overcome an obstacle that we knew had the potential to come our way, which is why we have a plan, why we are rolling out that plan, and why we once again can pull together to eliminate COVID. So here's what I ask today. If you're in Auckland, please stay at home in your bubble. Wear a face covering whenever you leave your home. For the rest of New Zealand, use a face covering in places where you're close to others, like on public transport. Download and use the app and make sure you can quickly access all your movements for the last 14 days in case you are contacted by the contact tracers. Businesses, please put up your COVID tracer QR code posters. And everyone, wash your hands, stay home if you're sick, and if you're unwell, get a test. We'll be checking in again soon, but till then, stay safe, stay kind, and stay well, everyone. We're happy to take questions. Jessica.
Minister, did you give consideration to an all of North Island level 3, given that we've had cases now outside of Auckland?
No, that wasn't something that was viewed as necessary, nor was it something that the Director General advised Cabinet was necessary. Of those cases that we have in the Waikato area, they have all been connected, they've all been contact traced, they've been tested, and they're in isolation. And that is part of our normal regime. We have to, of course, remember level 2 is designed to be able to coexist alongside a strong contact tracing, isolation and quarantine system. The issue is we have a larger outbreak in the city of Auckland, which is why we have a high level of restrictions there.
Debate about whether it should go down to level 2, given that it has been those 12 new cases today. I guess some people were expecting that to be bigger.
Ultimately, though, what we have seen is of those cases, we are contact tracing a large number of people. And they are groups of people who, prior to the identification of these first cases, so before we were aware of them, had attended churches, had attended schools. And so we're very mindful of the need that whilst we have a small number of currently identified cases, that we need to identify the full perimeter of this cluster and reduce down its potential impact as much as possible. We were very keen to allow ourselves the time to review. If we find, for instance, over the next 7 days that the perimeter is identified, that it's well contained, we give ourselves the space to consider our settings, but ultimately, for the sake of certainty, we foresee it being no longer at this stage than an additional 12 days. Perhaps give Dr. Bloomfield a chance to speak to his advice on that as well.
Thank you, Prime Minister, and kia ora koutou. So just to reiterate the points the Prime Minister's made, our public health advice is essentially consistent with what the decision Cabinet made, which was to extend the current settings for 12 days. The total of 14 days in Alert Level 3 in Auckland and Alert Level 2 around the country is the incubation period, but more important here is we feel that will give us sufficient time to have absolutely determined the extent of the current outbreak and to have contact traced, isolated and tested to identify that and confirm that, both within Auckland and any cases that further cases there may be outside of Auckland. So different from the situation earlier, there may well still be the odd case and the odd new case in 12 days' time. However, the plan now is, and the reason we have put all the effort in to strengthening our testing and contact tracing and to adding in this addition of quarantining our cases to, in particular, prevent onward transmission within households. The reason we've boosted all that is that we can contact trace and test and isolate our way through this outbreak. The alert levels provide additional assurance there. And I just want to make one final comment again on that quarantine situation. One of the bits of feedback we had is in some of the earlier clusters, we had some families, part of that Marist cluster, who ended up spending 46 days in their home environment, isolated, because they kept getting transmission within the family. So one of the key reasons we want to create that opportunity for a very managed quarantine situation for these families affected is so that that doesn't have to happen again.
Prime Minister, how likely is it that we will never identify the source of this outbreak? And can we extrapolate from your comments that, given it is a new strain and wasn't lying dormant, that it is linked to our borders?
No, because you will have actually heard me say that of the genome testing that's been done to date, nothing actually does draw that link at this stage between the case that we have and those who are genome tested within our quarantine. So at the moment, there isn't that link there. It doesn't rule it out completely, but that is what that testing has demonstrated to date.
Source.
Yeah, and so this is, we've had a number of theories that we've continued to try and chase down and that we will continue to pursue. You'll know that one that has been canvassed more broadly has been the idea of whether or not it was just a burning ember that existed in the community that now essentially has really been diminished as a potential because the strain that we have at the moment is not something that we saw originally in New Zealand. Of course, the cases at the moment are still congregating around one work site that was a cool store. There's a number of theories that exist, but not a lot of research that tells us at this point whether or not surfaces are in play or whether or not there was a connection through that supply chain as yet. We continue to pursue that, but we may not know. And so what I would prepare everyone for, we do not necessarily need to answer that question in order to contain and deal with this cluster effectively. In fact, overseas, that has been the case on many occasions, and in fact, in New Zealand, we've had those circumstances too.
Just that update from the 1 p.m. press conference when we weren't certain of the link with that one case that's in Auckland Hospital. You're now saying that it's likely linked to the cluster. Can you elaborate on that and how and what you know?
Yes, what I can add is that there is a connection between where that person's workplace is and the Americold workplace, and it seems very likely that we will be able to connect that case back to this existing cluster, but it's still not yet confirmed.
Prime Minister, what does today's decision mean for the timing of the election?
Today, the most important focus for Cabinet and indeed for myself on the advice of the Director-General was what we do with alert levels. And so that's not a decision that I have taken at this stage, but obviously we have another 48 hours, and so I'll take that time and make sure that you hear from me further on that in the interim.
Pushing it out 12 hours means that the election on September 19th can no longer happen, given the campaign.
Sorry, what was your rationale? Sorry?
12 days, sorry. Yeah.
Look, again, the focus here has been making this decision. I will make sure that we have extra detail on the question of the election, but the focus in the immediate point here has been making sure that we make a decision over what's happening for Auckland and the rest of New Zealand. One point I would make is that keep in mind, and I just add this for the benefit of the Electoral Commission, not to predetermine anything with this statement, but the Electoral Commission has done planning around offering an election within a level 2 scenario. I only say that to just remind people that they are taking precautions as well. I want people to be assured that they are thinking about the circumstances for New Zealand, whatever they may be in the future.
And the dissolution of Parliament then, so that is something you will make a decision on before Monday morning?
Of course, yes.
So what happens to the rest of the country when Auckland moves to level 2? Does the rest of the country stay at level 2?
We'll make an assessment at that time. So every time we reassess Auckland settings, we'll make an assessment around the rest of New Zealand as well.
Are you firm on that August 26th date, or have you given yourself some wiggle room with the review on August 21? If the mass testing showed, that the outbreak appeared to be contained, might we move alert settings? Ease them early.
Yeah, it's a review, and so we are giving ourselves that opportunity. We did want, however, to give people a bit of certainty around the planning. We foresee, at this stage, no reason why it will be any longer than midnight Wednesday the 26th of August, but we will be reviewing in 7 days' time.
Did you discuss making masks mandatory, especially
No, we've had good discussion around that. Everyone was continuing to be of the view that we need to continue to encourage their use, make sure there's provision for their use, and we'll keep that under advisement. But at this stage, people were satisfied with that decision.
Did you decide not to move Tokoroa into a higher alert level, given the 2 cases there?
Yeah, at this stage, of course, those cases are very clearly and directly linked to the travel and socialising of one identified case. They're being identified through contact tracing. They were proactively tested through that process and then isolated and quarantined. So that has actually been all in keeping with our plan as cases emerge or if we have an outbreak. The reason we've treated that differently to Auckland, of course, Auckland is the source. It's where we're predominantly seeing the infection. It is where we're primarily still determining the perimeter of the cluster. But Director General.
Can I make an additional comment on that? One of the things that's really encouraging in this outbreak is not just the testing that is happening, but how early on in their symptoms people are coming forward to be tested. So the cases in Tokoroa came forward to be tested on Tuesday, symptomatic, even though their exposure had just been on the weekend. And so this is a really critical measure for our success in being able to rapidly identify cases, isolate them, and then contact trace. And as I said at 1 o'clock, we already know that of the many hundreds of people we have followed up as contacts, we've had over 83% of them contacted and isolated within that 48-hour period, which is great.
Yeah.
So don't we have to identify the source of this in order to have confidence that we won't see a repeat?
No. Not necessarily. What also gives us confidence is the wide range of testing, and you will see here the fact that we've had 30,000 tests and are still identifying cases that are all traceable and connected to this cluster. So that's one thing that gives us confidence. Time gives us that additional confidence, because if there were additional cases, we would start to see those arise as well. And thirdly, our own experience. We have had clusters before where we haven't always been able to identify the source, and indeed overseas you see in the likes of, from memory, Dr. Bloomfield, Germany, I believe, has had clusters they've managed and contained where they haven't always been able to identify the source. It is still preferable, and we will continue all of the investigatory work to try and determine that, but it may be the case that we don't, and that wouldn't be a reason not to lower our alert level.
Yeah. What are the latest modelling numbers you have?
Well, actually, the most recent conversation I've had with those who have been talking to our modellers is that clusters aren't actually an easy thing or something you can successfully model, because everything is unique to that cluster. It's when you have wider outbreaks and multiple clusters that the modelling's more accurate. So the caution I've been given is that modelling is unlikely to be able to predict what we would see here. We can rely, however, on past clusters just to get a sense of how they tend to behave and the scale of them. And we have seen in New Zealand clusters that can get up to the 80, 100 mark. Is that a fair reflection, Dr. Bloomfield?
On the election question,
yes.
One of the options obviously you have available to you is just to leave it to the Electoral Commission, because they have the powers to defer. Would that be a prudent course of action, given that would take the politics out of it?
Yeah, look, again, as I say, the most important, and I think it's not an unfair statement, the most important thing for Cabinet, and indeed myself today, because that is where the decision over the election date at the moment falls. You're right to say that down the track it would fall to the Electoral Commission. At the moment, my focus was simply on making sure that our resurgence plan was in place, that we're doing everything that we need and we have the settings in the right place. I've got another 48 hours. I'm going to use it, and I'll come back on the question of the election.
Sorry to interrupt you.
Go ahead.
Who will you bring into your confidence? Who will you consult with over the election day?
Oh, well, ultimately, it's something that falls on my shoulders. I am aware, though, of the Electoral Commission's view and all of the issues they have to factor in. It's one of the reasons I did highlight that they have done preparatory work around the different settings New Zealand might be in. But I did make sure that I was briefed by them in that regard yesterday afternoon, so that I can factor all of that in my thinking. Brett?
Just in terms of the difficulty with the modelling, but
yes.
Do you then have milestones, though, that you can look at in terms of working out whether this particular cluster is coming under control, where you feel comfortable about dropping down the levels?
Yes. Dr. Bloomfield, because he has to use that information to give advice to us.
Yeah, so I think the critical thing is the pattern of the spread that we see over the next, and the cases we see over the next 7 to 12 days, and the sort of settings they are occurring in. So partly it's about the number, and also whether there is geographical containment and or whether those cases and or their close contacts have been in settings where there could have been further spread, like churches or schools and so on. We've seen that already. So again, it's looking at the pattern, geographical and those sorts of settings, the number of cases, the links between them, and also we'll also be looking for the rate of growth. We're growing quite quickly at the moment. We'll want to see that level off.
Yeah. One of the things we have discussed, though, is that don't expect that we have to see, for instance, 0 cases at all in order to move levels. It is something that we've discussed. Of course, our regime has to be built for us to be able to exist in a level 2 environment with the management of cases. What we will be looking for, though, is just to really have a sense that we've got what I'm calling the perimeter of the cluster under control. I'll come to Jackson.
Prime Minister, it's obviously still early days, but all of the cases except the one still under investigation can be linked to the same cluster. Have we dodged a bullet here?
It is heartening to see at this stage that linkage between all of those cases. We don't want to get ahead of ourselves. We've always taken a precautionary approach, because if you make a wrong move with COVID, we can see very easily the long-term impact of that, and particularly in terms of how long, as a consequence of the wrong move, you can spend with restrictions. And Australia, has demonstrated that to us. So we are looking at the experience of others and making our decisions.
The situation in Melbourne playing in influencing your decision to go hard very early?
We're evidence-based, and so you would expect us to look overseas at what other experiences have demonstrated, the likes of Hong Kong or the likes of Australia, where they have taken a little bit more time and existed with a more open environment while they've determined a perimeter of an outbreak. Our view is it's better to assess that with restrictions in place, so ultimately you can get back to freedom faster. That's our approach.
30,000 tests. Sorry.
Sure.
Thank you. Of the 30,000 tests, what portion were done in Auckland?
Forgive me, I don't have a breakdown with me here. I do know that we have that, though, by DHB. We can provide that. I wouldn't be surprised if it's provided publicly.
Yeah, my understanding, it's about half of them, so at least 50%.
Yeah.
After the 1 p.m. update, were you provided details of further testing results, or are you still relying?
We're sticking to the 1 p.m. Sticking to the 1 p.m.
Further positive.
I would say that there's, again, the pattern that we're describing here has not changed.
On the wedge...
So the pattern of the cluster has not changed.
On the move to a level 4, what are the criteria or the thresholds we should watch for if we need to go?
A good question. Nothing obviously that we're seeing here, but you'll remember that the criteria for level 4 is, multiple outbreaks, multiple scenes of community transmission, just a much larger scale than what we're dealing with here. Yeah.
Just on the extension of...
Does this set a precedent? So.
Just on the extension of the wage subsidy scheme, have you got any indication about how much extra that's going to cost?
I don't want to steal the thunder of the Minister of Finance, who will take the podium immediately after we've completed questions. But remember, we do have an underspend currently for the second extension. We had an estimate that it would be roughly 2.6 to 3.9 billion in terms of the drawdown on that. It's actually come in closer to 2. So there is already an appropriation that we can draw on for a wage subsidy extension.
With a third of the population now in much more severe restrictions for a much longer time, could New Zealand still consider itself a team of 5 million?
Yes. Not everyone in a team is on the field at the same time. And, some of us currently are on the sidelines really rooting for those who are experiencing those that level of restriction. And that's why I just asked the rest of the team to be really supportive, just to be mindful of that. If you know people in Auckland, particularly if you know people who are isolated, do reach out to them. Level 3 is not the same as level 4 though. We have a much higher rate of economic activity, much more people who are safely in the workplace, but that doesn't mean that there won't be people experiencing loneliness, anxiety and hardship. So we do need to make sure we look after each other.
Does this set a precedent here so that people can understand how future decisions will be made? So if 4 cases show up in Dunedin next week, could they anticipate 2 weeks of level 3?
No, not necessarily. And of course, we still apply to these decisions the framework for our levels, and they have a description over under what circumstances we would move either regions or the country. And so again, what's happened in the Waikato fits with level 2. We know that they're linked, they're contained, they're isolated.
It's a similar scenario, a cluster, what appears to be an outbreak, an unknown outbreak, beginning of another cluster in Dunedin in a week's time. Should they expect to move to level 3 immediately?
Again, very much depending on the scenario, because at the moment what we have is we don't have the beginning of the chain, which creates much more uncertainty. If you have the beginning of the change, even that changes some of the decision making. So that's why when we developed our resurgence plan, it was based on a range of different scenarios, because it ultimately will come down to what you're experiencing, where the chain begins and how wide and connected the clusters are. But covers it.
Are you satisfied with the rigour of restrictions on movement outside of Auckland? There have been reports of not insignificant amounts of people flying into places like Christchurch and Queenstown. Might the government sort of intervene and
one of the things that we did last time was we did allow enough time for people to relocate. And so that sometimes took a little bit longer than when the orders came in. What we're going to do over the weekend is look at the way that this is operating at our road checks, and we'll also have a look at the way aviation is working. I'm picking up on some of the anecdote that we're hearing, so we will reflect on whether or not we need to look again at the way we're operating that at the aviation border.
Just on that, do you have any evidence yet in terms of whether those passenger flows are tracking with what you would expect for purely residential movements, people returning?
Well, we know that from within Auckland, it's actually lower than it was last time we were in level 3, so that gives us something about the intra-Auckland regional travel. I don't have the data around between regions, but it is something we'll look at, and we are over the weekend reviewing some of that. Just mindful of the time, I'll take a couple more questions and then hand over to the Minister of Finance. Jenna.
Mine can go to the Minister of Finance. It's okay.
Okay, great.
Are you happy with today's decision? How did it stack up with the advice that you gave Cabinet this afternoon?
Oh, well, as I said earlier, it follows very closely the advice we gave, actually. And I should say that whilst the advice is under my name, it's not mine alone. I had a conversation this morning with my Chief Science Advisor, Dr. Ian Town, Dr. Caroline McElnay, the Director of Public Health, and they had worked with our team. We're in constant dialogue with the Public Health Unit in Auckland, meetings with them at least twice, if not 3 times a day. So it's a full range of advice from a lot of good people. The Prime Minister's Chief Science Advisor has been actively involved in the discussions as well. So I think there was a very strong consensus on what our public health advice was, and that's very much informed the Cabinet decision.
Then it's our job as a Cabinet to balance that against the economic impact on the Auckland region and the rest of New Zealand as well. And that's what Cabinet's job is, to then weigh up those 2 decisions. But our view is a strong health response is the best thing we can do for the economy. Benedict.
So was it unanimous at the Cabinet table today?
Yes, Benedict.
What was your view on the interview that Winston Peters gave last night to Australian television?
You will have already heard me speak to what the evidence is telling us. And the evidence is telling us at the moment that none of the genome testing that's been carried out to date and that is available to us of those cases we've had in our managed isolation can currently be linked back to the cases we have. And so that's the evidence that we have, and so that is what I'll be basing all of our decisions and assumptions around. Justin.
Bloomfield, is there any health advice that Cabinet has decided not to follow?
You mean today? No.
No, I don't think there's many generally, actually. I think that we're reasonably responsive.
Was it irresponsible for...
All right, Gina, last question.
Was it irresponsible for a Cabinet Minister to put information into the public that hadn't been provided by an official source?
I believe that he was reflecting information passed to him from a journalist, so perhaps we could ask the question equally on that side as well. I'm going to hand over to last question, Jackson. I'll be generous.
Did the Deputy Prime Minister apologise to you?
Oh, look, I haven't asked him to, nor would I expect him to. He is free to give his own interviews. You can expect that I will continue to just reflect back what the evidence is showing. That is what we rely on to determine where the source of this is. And as I've said, although we haven't yet found that source, we will continue looking very, very hard, despite the lack of a current link.